Well, welcome back to More About Birth. We're so glad you joined us. We have a special guest today. I'm here with Shannon Bennett, our host, and we have Susan Brady with us. She is a lactation consultant, and we're really excited to have you on the show today. Welcome.
Thank you.
And for those joining us. So Shannon, you want to take it away?
Thanks for coming.
Thanks
We're
for having
actually
me.
here today filming at Justice Family Chiropractic, which is fun. They are generous enough to let us use their building for all of our classes.
Yeah.
So this is kind of fun. How did we meet? I was thinking back about it, and I'm thinking it was back in the day when you had Buckwheat Bottoms, a storefront in Richland.
Yeah.
But I think that's where we first met.
That's where we met. So, and what I was doing there at the kind of the end of my Buckwheat Bottoms era was we had a bigger space. So we had more couches and more playrooms. We had a lactation consultant room. We had a classroom people were teaching in. And
I even did a natural pain relief class a few times in your facility.
I was so excited about that because it's so needed. And I would have people come in, like we've chatted about saying, hey, where do I find a doula? Or like, I'm thinking about doing like a natural childbirth. What do I do? And so being able to be like, oh my gosh, Shannon's
it was a great resource.
Having a class here. So
Can I just say from the guy's perspective, Buckwheat Bottoms, that's a classic name.
He's got it so stuck in his head.
Oh, yeah.
We talk about other things,
Yeah,
and he always calls it Buckwheat Bottoms.
Yeah, she'll go, no, that's not Buckwheat Bottoms. So it stuck with me.
It's stuck.
Finally, the only thing about Buckwheat Bottoms is just whenever you plan a business, don't pick a super long name. It's horrendous to try to fit it onto anything, or like filling out forms.
So you were having, if I remember right, like a Meet the Midwives night, and
I invited
some midwives to come.
Yeah,
and I think that's where we officially met.
I think so, because I know I reached out to Marcille, who, I had met her. She was there for the birth of my second child. And then she said, oh, let's make sure we invite. I said, yeah, get me connected.
Had Angela Reynolds, one of the nurse midwives in town.
Yes, Angela came. We had some doulas come.
Yeah, it was great. It
was
great.
really, really exciting.
So that's when we first met. It's been a few years ago.
Yeah.
And then I had the privilege of being at your last birth with Marcille as the assistant. That was really fun.
You should always have two amazing people at your birth. And I had an amazing doula too. So my birth was just fantastic.
Yeah, it was a great birth.
Just a shout out to Marcille, who's a very close.
She's my buddy.
Yeah, she's your buddy, just in case she's listening. Hey, Marcille. So this is like one of your clients that loves you here on the show today.
It's true.
Yeah, I plan to have her on the show eventually. I'm bugging her to come talk about pelvic floor rehab.
Oh my gosh.
I know.
Yes.
Big topic.
Let's do it.
Yeah, it's a great
so what in the world prompted you to get into this lactation consultation? Was it your little room at Buckwheat Bottoms that started it?
Well, that was the open door.
I mean, how did that even work?
That's a good question. So, my faith plays a big part in my life. And that definitely was one of those moments when I look back and I'm like, okay, all right. Because I'd been praying about, we need some breastfeeding support. And we have a Lactation League here in our town in Tri-Cities. And so that's been there.
I love the concept of your drop-in kind of thing. It's like, you're having a bad day with nursing, you can drop in. You don't have to have an appointment.
Yeah.
It was great.
It was fantastic. And I
laid back.
So I was at my second storefront, so the one before anyway. Okay, so we're there, and one day this woman walks in and she goes, hi, we haven't met, but I'm a lactation consultant and I've just retired, and I was wondering if you need a volunteer.
No.
I'm not joking.
That was a God thing.
It totally. Yeah. So I was like, oh my gosh. So of course she had heard about me because, a family friend of theirs was a customer at the store and would come hang out. And her name's Chris or Christine. And she worked through the hospital. She was one of the lactation consultants who was really, really active in really promoting just like a biologically normal breastfeeding.
And that kind of took off, didn't it? I mean, you were busy with your drop-in.
Yeah, so she would come on a set day of the week unless she was out of town. That was always her rule. I'm retired, so when I'm out of town, I said, that's fine. We'll take what we can get.
Yeah, volunteer. We'll take what we can
She was fantastic. And so people would just pop in. Some days were slow and other days were super busy. There was no appointments. It was all just gifted. From
new
her.
moms don't do appointments.
We can't.
No.
We're just staggering around. So that's how that started. And so then at our new storefront, when we moved in, I made sure there was a special room.
Yeah.
And we kind of kept the same concept. And she continued to volunteer. And then I've always been intrigued by breastfeeding.
Now, you nursed all 3 of your children?
Yeah.
Did it go well for you?
Oh.
That was a loaded question, right?
Yeah. Well, to unpack it just a little, to tell my story. I love hearing stories, so it's fun to get a chance to share mine a little bit.
I think the listeners love hearing stories too.
So my first baby was born at the hospital, and we had not a really traumatic delivery, but our I have shoulder dystocia babies. They just, that's how I birthed them. And like when you look at the statistics, it's really low that you'd have that many repeats. Well, I'm the really, really low statistic. So
I have a client like that, every one of them.
So we know what to plan for. So he was a shoulder dystocia, and of course he was our first. So anyway, the delivery was really tricky. And so, when you have really tricky deliveries or long births, it impacts breastfeeding. And I think that's the part that people aren't aware of.
Mama's tired. Baby's had a rough trip. Yep.
And I ended up with tons of IV fluids, almost a blood transfusion.
Did your milk not come in right away?
No, it didn't. Yeah. And latching was really horrible. So anyway, it was a really bad experience. Not really because of breastfeeding starting poorly, but I had a really, really negative experience with a lactation consultant.
Oh.
So bad that I still will, every time I talk about it, start to tear up. Even now, I just know it's like clockwork.
That's okay.
And so that moment really shaped my view of what real breastfeeding help should look like.
Yeah.
Because it was so traumatic. And the blessing in all this is I had that super, super negative experience. But I was so committed to try to breastfeed. That's what I wanted to do.
Knowing you, I bet the wheels started turning inside your head, and she had this whole plan mapped out.
Well, not at the moment. Mostly I just was crying. But I had a doula. So I left that appointment. My husband got me down to the car. We got our baby in, and I just burst into tears sobbing. And he said, why don't I call our doula? Because he didn't know, he didn't know what else to do. Now? Dads often, they're like, okay, well, we fed the baby. Like, isn't that what's wrong?
Yeah, they have no clue, I guess.
Well, and it's so, your wife's just falling apart, like deep, deep soul sobbing.
And you don't know how to fix it.
No, you can't. And you want to say like, oh, well, things are okay now, right? Like everyone said it's okay.
Oh yeah, we're going home.
Everything's fine.
Perfect, not?
But she's not. So the doula mentioned, oh, well, there's a woman in town who does a little bit of breastfeeding help. Why don't we call her? And her name was Jessica Burden.
Oh, I remember Jessica.
Everybody loves Jessica. And she floated into my house that hot summer afternoon, and I'd been crying, and I was bleeding, and I was sweating.
Aww.
And she came in, and she goes, hi, I'm kind of sweaty. I was out doing yard work, but I wanted to come right over because
oh, she's so sweet.
She's so sweet. And you know what she didn't do is she didn't dive in trying to help me. She just said, Susan, wow, why don't you tell me your story?
Yeah, she's good at that.
And of course, it just
more tears
came out, sobbing. And she didn't fix anything that day. And she didn't really have a lot of clinical skills.
But I bet you felt like you had a friend.
Oh my gosh. And what she did, she handed it back to me. She says, you know what I know? I know that moms know what to do. Mm-hmm. So why don't we talk about this, in a way that you know what you're doing, and your body's not broken. Your body's not broken. And after that, I sort of started to kind of heal from that, and I put my shoulders back and I said, you know what? I can do this. And if it's not working and we keep trying, I'm going to find some better help. Mm-hmm. So that is sort of my history with that. And so Jessica, wherever you are.
Thank you.
Another shout out.
Yeah, she changed so much. And I often think of her, particularly now that I have more skills and training and some more of those clinical skills, and, too much knowledge is totally a bad thing. Sometimes, you just immediately overthink something or you dive in. I always try to back up and say.
It's like using Dr. Google. It's always a bad idea.
It's a terrible plan to back up and just say, tell me your story. Mm-hmm. Tell me what you want.
And we're going to go to a break, but after the break, I want to talk about like what types of things that you do and what are some of the most common problems that you see now that you're a consultant.
Yeah.
The things that you work with.
Let's do it.
So, all right, we'll be back.
Thanks for tuning in to More About Birth, and we're excited to have our special guest, Susan Brady, with us, and we're going to be back with so much more, so stay tuned. Well, welcome back to More About Birth. We're really excited to have a special guest. I'm here with my host, Shannon Bennett. And you have a special guest. Why don't you introduce her this time?
This is Susan Brady, a friend that I met several years ago at a storefront where lots of mamas hung out. Mm-hmm. And I had the privilege of being at her last birth as her birth assistant with my good friend Marcille, who is also a midwife. Before we get talking about the topic of lactation consultant and issues that nursing moms have, I wanted to just let you know that I'm super excited because I've got this natural pain relief for labor manual that finally came in the mail, and look, it even has an ISBN number. I'm sorry, that part's so exciting to me.
So cool.
It makes it official, but I'm loving this. So this is something that is a tool to help you through labor with natural pain relief techniques. There's places to take notes.
Yeah, and we're shooting right now in the facility where you teach your class.
This is Justice Family Chiropractic, where our class will be. We're going to shoot live this class. So, and if you go to the website that finally is finished, the new website, it's ncmidwifery.com. And if you sign up for the email list to get notices about our classes and new things coming up, you can download this labor and birth plan that will help you just kind of map out the things that you do and don't want for your own birth. And it's just got great prompts in there, places to take notes again. So go to ncmidwifery.com, sign up for our email list, and you can also access this podcast there.
Yay!
So, Susan, we had talked about how you kind of got into all this. Tell me, what are like maybe the top 3 things that people call you about?
Sore nipples, low milk supply, and then kind of hand in hand, my baby's underweight, everyone's super stressed, or my baby won't latch.
Okay.
Can't latch. Yeah.
So what percentage-wise would you say, how are you able to help them? I mean, most times, 90% of the time, is it something that you can help them with?
I say 100% of the time. Awesome. Because it kind of goes back to my job as, the way I view my job is as a lactation consultant is not necessarily to always fix everything, right? I'm going to address that. So don't you worry. If you come to see me, we're going to try to uncover the root problem.
Right.
But more importantly, my job is to empower that mother to be in charge of her own baby feeding story. And so one of the questions I ask in my intake questions, as well as I review at the very first part of any visit I do, is what are your goals, right? Because sometimes a woman doesn't actually want to be an exclusive breastfeeder.
Right.
I'll just say
Or she might plan to breastfeed for 5 months and then she's going to return to work and bottle feed.
And that's not an interest to her. So whatever the problem is, or whatever the presenting concern is, or even the pediatrician has referred them over because there's some weight gain or transfer issues, we're going to address that. But above all of that, I want to make sure whatever care I'm providing aligns with what the mother's interested in. And I love it when dads or partners can come with them, because this isn't just about baby feeding. When I help a family with breastfeeding prenatally, or, in the postpartum, immediate postpartum, so their baby's a couple days old or a few weeks old, or their baby's 9 months old, and there's all these things. It's a family care plan.
In fact, that would be a great podcast someday to talk about a father's role in the breastfeeding realm.
Please.
Be a great podcast.
Well, and we talked about that before we even came today,
Yeah.
just about the relationship of the guy and this whole concept of
Yes.
feeling left out maybe
Yes.
or
Yeah.
helpless and
Huge.
don't know how to help your wife
Huge.
through the problems she's having.
Absolutely. Well, and dads,
Being a support.
Yeah, they want to fix things.
Oh, that's a whole nother podcast.
Right.
Huh?
So
what? How does this happen? They call you, people
Yeah.
refer you. Where do you meet them?
yeah, so
Where do
I'm
you see
kind
them?
of fine tuning this all, right? Because as I've taken on more clients, you have to streamline things. So right now I have a website.
And what is your web address?
It's www.nourishingus.com.
Okay.
Nourishing
We'll get
Us.
that on the bottom of the podcast
That'd
for
be
you.
awesome.
So.
Yeah. So, right now, people can book prenatal visits, which some people are like, "What?
Why do I need a prenatal visit?
I'm not breastfeeding. I'm pregnant."
But there's things we can do that will make the whole experience so much better.
Absolutely, and that's the time to prepare is not when your baby's freshly hatched.
I always tease people and say, "Do you have good nursing nipples?" They're like, "What?" Like, let's talk about this.
Let's talk about that.
Because if you don't, we need to fix that before the baby comes.
Right. Or let's find out, because I have so many women come in and they're like, a nurse or somebody looked at me and they told me that I probably wouldn't be able to breastfeed. And I'm like,
rude.
How would they know?
Rude.
Were they watching your baby feed?
So you're doing some classes ahead of time and some
I do
consultations ahead
one-on-one
of time?
office visits or home visits for prenatal. So that's just me and the family. We kind of chat through. If the mother wants, I'll do a prenatal breast exam so we can chat about those things. We talk about those goals.
Right.
Sometimes it's it's their second or more baby. They've had negative experiences in the past. This one, they really would like to have more breastfeeding success. So we're chatting about that. And then I do a lot of postpartum home visits in our community. And then I do virtual care as well.
So is this FaceTime, Skype?
So right now I have a platform I use. Milk Notes is what I'm using right now.
Cute.
Yeah. And so we can both log in there. But if the mother is okay with it, we can use another platform that's more convenient for her. Really, as with most of the things I do, I try to kind of cut through the fluff and be like, listen, where are you at? Like, is like a phone call going to be all you can manage? Let's start there.
Right. Or even a text.
Exactly.
Send me a picture.
Yes.
Yeah.
Yeah.
Well, the interesting thing to me, guys, is that, you have doulas, now you have lactation consultants, you are doing breastfeeding consulting, and I mean, a midwife can't do everything.
No.
I mean, there's a lot of responsibilities.
We try, but you just can't.
It's interesting how there's just this whole network now that's surfacing, at least from my perspective.
So they can come see you at your office.
Yep.
You can come see them in their home. We can do virtual visits, phone calls, texts. Is there a different fee for all of these things, or is it just like one lump sum?
No, so my office visits tend to be a little less than my home visits, and then follow-up visits are a little less.
Give me just a little snippet of what you do. I mean, you take a look at baby's latch, how baby's nursing.
I do. Yeah, so
history of weight gain.
Yeah, so first I want to hear the story, and I love stories, like I said. So I want to listen to the family story, and if dad's there, I love it if dad can chime in, because
they have a different perspective.
They have a totally different perspective. And often if it includes birth details, the mom's sharing something and you can see the dad's eyebrows kind of going
That's not how it happened.
I don't remember that. Or like, it was 6 hours later, Sudie. She's like, really? I thought it was 6 minutes. Right. So I always collect a birth history because birth really impacts breastfeeding. And then we kind of go from there.
I know you've sent people to see Molly, who we interviewed at one of our other podcasts to do some craniosacral therapy.
So she is fantastic.
Yeah.
Molly.
So we really do have a great network going on.
I think we're really growing in skilled professionals who are.
So speaking of skilled professionals. So we have a lot of skilled professionals in the Tri-Cities now that deal with tongue-tie issues, which seems to be a really hot topic. And it's also a very controversial topic. And I have my own opinions on it. And I know you do also.
I do.
How often are you seeing issues where baby is tongue-tied? And maybe just explain what that is for people who don't know.
Yeah. So tongue-tie, Careful, don't Google it quite yet.
Yeah, don't go to Dr. Google on this one.
So,
now they're going to do it.
They are. I know. Susan. So tongue tie is, we're talking about connective tissue inside of the mouth.
Mm-hmm.
And you do want connective tissue. A lot of people will be saying like, oh my gosh, well, I see something in my baby's mouth. And I always say like, well,
there's supposed to be something,
good.
right?
That, we don't want the tongue just falling down the back of the throat. We should have connective tissue. So a tongue tie is when that connective tissue is restricting motion or movement.
Right.
Right. So
and most often we used to call it short tongue babies.
Yeah.
But really what it is it's keeping their tongue from coming out and under the breast to be able to empty the breast.
Or lift, right? So you have, the tongue does all sorts of cool things in the mouth. It moves side to side. I mean, it's very complicated, but to simplify it, it moves side to side. It goes out, it goes up, and you need lift. You need this lift. So a tongue tie, right, that connective tissue underneath the tongue is essentially kind of too tight. And so we call it a tongue.
So the tongue can't do its thing.
Right.
But now we have these specialists that are in the dental field that actually release that tight connective tissue. And I've seen it do amazing things for some babies and their weight gain and mom's amount of soreness.
Right.
And I've also seen it as a midwife totally destroy the whole nursing rhythm to where baby wouldn't nurse again. So what are you seeing, and why in the world does everybody have a tongue tie now?
Well, I think that this is something that keeps me up at night, if I'm honest. I wish I could, every single time I see a baby and I see something, we'll just say, perhaps there's tension there, and you're putting together the story and you're looking and you're doing a clinical evaluation. I wish I could always tell, this one's the problem.
I mean, occasionally it's bluntly
so
obvious.
Absolutely.
Classical. And other times you're like, do I send him in or don't I send him in?
Well, and so you asked, how often am I seeing tongue tie? And the answer to that is, I don't know how to put a percentage on it right now, because a lot of the people it is very common, but I do see a lot of people in our community come to see me after they've had a revision done, and they're frustrated because things have not improved. Either they may have improved slightly, but they still aren't exclusively breastfeeding, and that was their goal, or they really haven't seen significant improvement.
So I'm just going to put this out there as a midwife, how I feel about this. And I probably will have some people that don't agree with me. I've sat through some of the very best seminars on tongue tie as a provider.
I have done so much tongue tie training now.
And I totally see it. But as a midwife, like I said, I've seen babies that we thought, we got to get this kid in there day of birth, or this just isn't happening. And that baby wouldn't nurse for like 2 weeks. It was, pump and eyedropper feed. Baby would not suck. That's rare.
Right.
But mostly, if it's very blatant as a midwife, I like to send them in right away.
Absolutely.
Let's get this taken care of. But a lot of times I take the watch and wait approach.
Yeah.
Because you might have a baby that really probably could use a revision, but just because of mom's anatomy and the size of baby's mouth and the vigorous suction that baby has, baby's still gaining weight. Mom's not sore. We've got a great milk supply, and there's no issues. And the other thing I see is that usually if it's just kind of a problem, it's like, do we or don't we?
Yeah.
If you can make it through without being too sore or having too many major issues, around 12 weeks, that baby has grown enough that the mouth is just enough bigger that things just all pan out.
Yeah.
So it's very individual.
I think that that's true. And I think that one thing that families need to keep in mind is that we want, before someone revises a tongue tie for you, they should be doing a complete functional assessment, which means looking at how is the tongue moving?
Right.
What does the airway look like? As well as what is the baby's body posture? Because sometimes these babies,
if you have an
out.
asynclitic baby that's coming out with its head cocked to the side, you have really tight jaw muscles on one side as opposed to the other, and the tongue doesn't move as well.
Or for my hospital delivery moms, if you've had a vacuum extraction delivery, you are very likely to have extremely painful breastfeeding that doesn't resolve immediately, and it's probably not a tongue tie.
And that's where the craniosacral therapy, newborn chiropractic, sometimes even speech pathology.
All those professionals.
Yeah, and I was going to say that's one of the things Molly talked about, that the head adjustment, the baby may not feed well on one side.
Right,
and
because
then the
we call it sided. They're just kind of, lean to one side.
Yeah. And I think what's difficult right now, it's difficult for families, it's difficult for the dentist, it's just difficult for us as providers who are meeting this family and this baby at different stages and ages, is that from a dental perspective, at least from the training I've done, so don't put words in anyone, this is just me, they're focused really on those long-term health outcomes of
like a lisp or a gap between your front teeth.
Or like we don't want the palate to be too highly arched because, that's going to cause airway and orthodontic work, sleep apneas. And those are all true. However, my primary goal when I meet with a family and a baby is to remove impediment to feeding.
Yeah, nutrition.
We and that's where you're talking about, and I see that more often than I wish I did, where we've done an action, we've done a revision, and it has not improved feeding. And
and sometimes it's magic.
It is.
It's like overnight or even instant nursing difference, and other times it didn't make a huge difference.
Right. And I think that the key to this is to not oversimplify tongue tie. And I think that's what's happened is that
we not overcomplicate it.
Right.
And I send people to our local providers all the time to be evaluated.
Me too.
And the bottom line is, I don't think anybody truly knows exactly what the deal is with all these tongue tie issues in the last 10 years.
We're still working on that. Yeah. Although the talks and whatnot, everyone's still. And I love how almost all, you may have experienced this as well, most people are just saying at the end of everything, these big presentations you sit through. So, that's our current best practice. And I think for families to really hang on to that for tongue tie. If you think your baby might have a tongue tie, reach out to a professional who's going to help you navigate it.
And if I'm not mistaken, they do free consultations 1 day a week, most providers, right?
Some of them do, yeah. And I think that getting your care team together is really helpful.
And some insurance companies will pay for that, and other insurance companies will not. And it tends to be anywhere from $350 to $500 to even $800, depending on where you go. But in wrapping this up, I just want to say that Susan is a great resource for anyone out there who needs help with nursing. We'll put some information on the bottom of the screen of how to get a hold of her. And if you're having any breastfeeding issues, don't ever hesitate to email me or email Susan
reach
or
out.
any of the midwives.
Anybody.
We are always more than happy to help you. We want to see you succeed. And Susan, thank you so much for being here today. We're going to send you home with a More About Birth mug filled with chocolate because we don't do podcasts without chocolate.
Always.
So
always chocolate.
Thank you.
So key.
And we'll have you come back sometime and we'll talk about the whole
dads,
breastfeeding, how that all kind of meshes together.
I think that
sounds like a good podcast.
Yeah.
Well, thank you for tuning in to More About Birth. We hope you'll continue to join us here each week. And we want to say thank you to our special guest, Susan Brady, and your incredible conversation about so many cool topics. So
it's hard to stop.
Yeah, we'll see you here next time on More About Birth.